Service Strong. I'm your host, Liberty Simmons, and today we have a very special guest for you today. Dr. Karen Kaufman with Kaufman Allergy, Asthma, and Immunology. Dr. Kaufman, it is so wonderful to have you on Service Strong because you have a very unique story. You are a Navy veteran, a Navy physician, and you also have a practice here locally in the Vienna, Virginia area that deals with asthma, that deals with immunology conditions. So tell us a little bit about your story.
Thank you so much for having me with you this morning, Liberty. Really appreciate it. So my name is Karen Kaufman, and I'm the founder of Kaufman Allergy, Asthma, and Immunology, which I opened here in the DMV in 2021. And at that time, I was really looking for a way to practice medicine differently. You know, I really wanted to kind of create a practice where patients felt like they were guests in my home, and where they could come in and not necessarily feel like kind of a number or not feel like an unknown person in a large, in a large clinic. I wanted to create something where patients would get the care that they deserved, to get better, to be able to, be well on the least amount of medicines that they deserved, and to get well again and to regain the quality of life that they very much needed. And so I decided to open my practice in a wonderful part of Vienna, which is so easily accessible to patients from all over the DMV. And it's been a wonderful journey. Since we opened in 2021, we've had a lot of time and growth where initially it was just me, who opened the practice, and I was seeing patients by myself. And now I have some other wonderful colleagues, some physicians who work with me to be able to serve our patients.
Yeah, absolutely. And just tell us a little bit about what kind of medicine you are specializing in with allergy and immunology conditions. Kind of explain it for people who don't know, who don't have allergies like me, or maybe I do have allergies, but I never went to see a doctor for it. So tell us what you treat and what you see in your patients.
Sure. So we treat both children and adults. As allergist immunologists, we really see patients throughout their entire lifetime. And even in young children, we manage problems like food allergy and eczema, environmental allergies and asthma as those things develop through life. And even, in adults, we treat other things as well, including drug allergy and chronic hives and swelling, and a lot of different immune system disorders. So, these are things that can affect people at all different times through their life, and that's just one of the joys of practicing allergy and clinical immunology, is that we're able to kind of, see an entire family in multiple generations, because allergies and immune system problems can affect people at all different ages throughout their life.
Yeah, absolutely. And so tell us a little bit about your background and upbringing, because you're from Pennsylvania.
I am. So I grew up in Pennsylvania. My brother and I were raised in the Philadelphia suburbs, and after finishing high school, I went to Penn State University for my undergraduate. And after graduating quite a long time ago now, this year will be 25 years ago out of college, I went to medical school in South Florida at Nova Southeastern University, and then went on to my postgraduate training. Initially in internal medicine. That was really when I joined the Navy. So I was doing my training while I was on active duty, and spent 3 years in internal medicine residency. I practiced general internal medicine for a couple of years at Naval Hospital Pensacola in Florida to serve our community there, and then went on to do my allergy and immunology subspecialty training from that point onward.
And so what about allergy and immunology was fascinating to you? What are you seeing in terms of your patients? Is there a big need here?
Yeah, that's a great question. I think one thing that makes allergy and immunology such a wonderful specialty is that we really can make adjustments and changes in medical conditions that have a lot of chronicity that can truly change the trajectory of how people live. We could really, reroute what the immune system is doing and allow, children to grow into adults with far fewer symptoms, requiring less medicines. We can really do things that can truly make people's quality of life substantially better which I thought was such a wonderful thing versus, some of the other things that we, do as in internal medicine, and many of the specialties of internal medicine are sort of kind of temporizing chronic disease processes, which is so important. But in this case, I really felt like we were able to kind of make a major difference in changing the way that people live for the better.
Yeah, and so tell us some of the things you usually see in children patients. We saw a photo of you treating a child right there. What do they deal with? The first thing that comes to my mind is asthma, right? But I'm sure there's more things that you're seeing.
So many, absolutely. So yeah, I would say some of the more common things that we see in our our infants and toddlers, we manage a lot of food allergy and eczema or atopic dermatitis, which is sort of an effect on the skin where allergies can drive an inflammatory process. So kids will have a lot of skin rashes, and as kids go through early childhood, they sometimes will develop environmental allergies. So things that we think about like hay fever, runny stuffy nose, sneezing, itchy, watery eyes, and asthma, as you mentioned, is such a a prominent problem that's so very closely linked to allergy that we see in children as they grow. So those are definitely some of the most common things that we see, but certainly there's a large volume of problems that can affect people throughout their life. So those are just a few.
Yeah, and we'll go into more detail about the other conditions that you treat and help patients with. But coming up, stick with us because we will talk to Dr. Kaufman about how her military service helps her in her role as a doctor today. Welcome back to Service Strong. I'm your host, Liberty Simmons, and we are here with Dr. Karen Kaufman with Karen Allergy, Asthma, and Immunology here in Vienna, Virginia. And Dr. Kaufman, we were talking about how you treat child and adult patients for things like asthma, food allergies, but talk to us about how you went from internal medicine in the Navy and then transitioned into that, and just talk to us about how your Navy experience helps you in your role today.
Sure. I think one of the things, to be honest, that I find that the military really helps provide for service members is the personal growth as a leader. And I think it particularly in military medicine, in addition to just learning how to be able to serve our patients, our active duty service members, our military families, we also really are participating in military leadership, and we're running clinics, and we're interacting with people, whether it's nurses or hospital corpsmen or people that are helping to support the mission of treating our warfighters and families. That leadership, I think, has been such a huge strength for me now as a leader in my own organization, to be able to build a practice and to be able to kind of move that practice forward. Those experiences are some of the best ones, I think, that I've pulled from my Navy career forward that have helped me later.
Absolutely. And you've also done humanitarian aid missions. So let's talk about that when you were on the Comfort, right?
Yes. Yeah, so I was on the USNS Comfort in 2009, and that was part of the Continuing Promise mission to Central South America and the Caribbean, where we were providing humanitarian aid and, kind of that political camaraderie with some of our partner nations that are down there. And it was a wonderful experience, really eye-opening to what things are like in other parts of the world from a medical perspective of, where people are starting from, the kind of care that they're able to get locally and what their needs are.
And so did those patients that you treated on that humanitarian mission, did you often see allergy and immunology conditions as well, or did that kind of generate later?
That was all things that happened later. And what's interesting, I think, is in parts of the world where there isn't as great of infrastructure, we tend to see that the immune system gets really busy doing things like fighting infections, much more so than kind of developing that hyper-responsive, more of an allergic kind of presentation. So really we were dealing with a lot of kind of chronic disease, but also some, chronic infectious disease as well. So that was a really unique thing that we saw down there, where patients were having certain types of infections that we don't often see here in the United States.
So you probably got a valuable experience treating all types of different conditions and health ailments. Talk to us about this photo here. Was that on the same humanitarian aid mission?
It was, and I love these old pictures because we had these makeshift kind of clinics that were set up in all different locations, whether it was in a school or in a stadium, and we kind of had, it was just what you see. It was a couple of chairs. We had some folks that would help us with translation, and we just tried to go, through lines and lines of people who lived in the towns where we were and try and see and help as many people as possible.
That's amazing to be able to treat patients and have medical care going in just anywhere, anytime, any place, any climate, any condition, and to still be able to deliver that care to those in need. So what was that like for you as a young physician doing all that in the Navy?
It was really just such a valuable experience. I think very eye-opening to see, what's out there in the world and how other people live in other places, but also to be able to feel needed and to know that even though sometimes we weren't doing much, right? We were maybe, treating someone with anti-inflammatories or even just multivitamins, how that could make such a big difference for people.
And it's not just your own service. You come from a family of military service. Let's talk about your father and your husband, too. He's a Navy pilot. How does that dynamic make you a stronger leader in your own practice and someone who cares for their patients?
So yes, my husband and I both met while we were on active duty, and my husband has since retired from military service and now is a commercial airline pilot. And so as a military spouse, many of us have had experiences where, we're trying to keep things afloat at home while our spouse is doing their job and wherever that takes them. So I think having that kind of unique experience of both being an active duty service member myself and also having the role of military spouse, when our children were young and having to kind of navigate, that kind of dichotomy of life when everybody's together and then life when the family's apart. I think that just having that perspective is helpful. We treat a lot of military service members in our practice, and so, just to be able to have a good understanding of what their family life is like, when it comes to allergy, many of them have, relocated to many different places, and so their exposures will be different. And so I think that unique perspective really helps.
Yeah, I'm sure that really helps your patients because you've gone through it too,
Sure.
the multiple moves, and it is so difficult to be in a military family or a dual military spouse situation dynamic, and also run your own practice, I'm sure. How do you do all of it?
Well, he retired by the time I had opened the practice, but
Okay, good.
Still, I think even as a commercial airline pilot, he's still gone for work. When he goes to work, he's gone, and so we definitely lean on our community, and they always say it takes a village, and it's totally true. And whether it's friends or other parents to help with carpool or whatever, I think just to be able to rely on one another and to embrace the community that we live in, it definitely helps.
Absolutely. And thank you so much for sharing your military experience with all of us. And coming up, we'll talk to Dr. Kaufman about just all the offerings that you can also take part in if you visit her practice in terms of allergy and immunology conditions when we come back. Welcome back to Service Strong. I'm your host, Liberty Simmons, and we are here with Dr. Karen Kaufman with Kaufman Allergy and Asthma and Immunology here in Vienna, Virginia. And Dr. Kaufman, we were talking about how your practice takes on some of the tougher cases, maybe those patients who have seen multiple allergy and immunology doctors and haven't gotten the answers that they were looking for. So talk to us about how you treat your patients and kind of the different offerings that your practice has.
Sure. That's a great question. And, I think one of the things that really helps us to be able to serve our patients in the best capacity is to really, to listen with empathy and to really make sure that patients are heard when they come to see us. And that really, crosses all areas of medicine where, it's not really any one particular condition that we specialize in, right? So We see patients with all sorts of problems, whether it's allergy, asthma, or very complex immune system problems. But there are a lot of ways that we can help these patients. Not only do we, do allergy testing and evaluations within the office, but in addition to that, we have a lot of different offerings to really dig into figuring out what's going on and why. We want to get to the root cause of their problems. We want to be able to give them solutions. So some of the things that we are able to offer include things like, complex pulmonary testing for our asthma patients. We're able to, get deep into the nasal cavity and look in there with a scope and see what's happening in the sinuses, and for people who have nasal polyps, as an example. We're able to treat our immunodeficient patients right in our office, and we treat many, many patients with immunotherapy to change the way that their immune system recognizes their allergens. So lots and lots of different things that we do to manage our patients in the practice. We provide comprehensive evaluations and then really try to partner with our patients with shared decision making to be able to determine what's the best thing for each one.
So if I have an immunodeficiency or an allergy and I have gone through so many doctors, what message do you have for me? What do you want patients to know who may be looking?
Yeah, I think, always just looking at every situation with a open mind, and to not really paint anybody into a corner and put anybody's, clinical scenario into a little box because it sounds like something familiar. We really want to dig in and determine why are things happening, and then what are the solutions that we can provide for them, to really think big. I think we do a really nice job of that.
Are there any misconceptions that people have with allergies and immunologies that you want to clear up?
Yeah, I think one of the more common ones that we see is that sometimes patients get labeled with a diagnosis based on their symptoms. And it's really tough because for some disorders, there are, very clear diagnostic criteria. And so what we don't want to do is be presumptive, right? We want to really dig deep. We want to do great diagnostics, whether it's with allergy testing in our office, whether it's, laboratory testing. We want to really figure out what is the problem that we're treating, rather than just being presumptive and labeling patients of, you have these symptoms, so you must have this problem. It doesn't always work that way. So, we want to really make sure we're being super comprehensive in our evaluations, so that way we're able to, provide patients with, evidence-based care that is going to really, make the change that they're looking for.
And you mentioned that you have military families as your patients, and in addition to the general population, but also veterans. What do you see with them likely? Do you see them have more asthma cases, or do you see them have a different kind of immunodeficiencies or allergies?
It's a big mix, to be honest with you, across the board. And I don't know that there's anything necessarily unique to military, service members or veterans or families who move around a lot compared to, the general population. But we absolutely see a big mix. We even do a lot of evaluations, especially in kids and teens that are looking for future military service. So people who have maybe a history of food allergy, to help them get that sorted out before, moving forward with their even potential career options. So there are so many different facets of what we do that really can help, military families throughout the course of their life.
Yeah, absolutely. And you have another venture. Not only do you have your own practice in Vienna, you're launching the Corneva Clinic. So tell us about that and how you're trying to use that to help people with menopause.
Yes. So one thing that I can tell you as a physician entrepreneur is I'm always looking for problems to solve. And one thing that I kept finding over and over again in some of our patients, our women who are of perimenopause and menopause age, was that particularly for our patients with very significant immune complexities, whether it's immune dysregulation, immunodeficiencies, even bad allergies or autoimmunity, that many of these women were going untreated with regard to their hormonal care. And it's not because of any one thing, but sometimes these patients were kind of viewed as being too complex. And I just felt like, gosh, these women would do so much better in so many other regards if somebody was addressing this very important part of their care. You know, all women go through menopause. It's normal, right? But the symptoms that come along with it are things that are manageable. So that's where the idea for the Corneva Clinic came about, and it is a brand new practice that's going to be launching very soon. That's going to be a telehealth-only practice where we can really, serve these same patients that I see in my allergy and immunology clinic from a different perspective. So really to address all of the things that really, help us to live well. It's such a big piece of that, and it's something that goes very much unaddressed.
All right, and lastly, just tell us what drives you to serve in this way.
I think I've always been a person who has grown up, even when I was young, looking to serve others. My parents were people of service and instilled that in me in a very young age of the importance of serving others in your community locally or on a greater scale. And I think it feels great to be able to, I live in the community where I work, right? And I'm able to serve my own community and to make it a better place by really improving the quality of life of others. So I'm so grateful. It's such a gift to be able to do that.
Well, thank you for your service, Dr. Kaufman, and for joining us on Service Strong. And thank you for watching Service Strongs. Tune in next week where we will bring you more men and women who demonstrate what it truly means to be service strong. See you next time.